What's the difference between CCM billing codes 99487, 99489, and 99490? Find out next. Hi, I'm Blair Thielemeyer, and I work with pharmacists who want to build and grow their clinical consulting services. Today, I'm going to talk about chronic care management CPT codes and the differences consultant pharmacists can use between the different codes. The first code I want to talk about is the first one that came out, the 99490 code. 99490 is coding for a service that's offered once a month. It's usually a 20-minute non-face-to-face clinical consult, so that can be over the phone. It could be the consultant pharmacist working on the patient's chart or doing a medication reconciliation, maybe even counseling the patient on their health goals. It's really for an ongoing chronic condition. The patients that qualify are those, of course, with 2 or more chronic conditions and 6 or more medications. And it really is to help serve the patient as a whole, whether it's transportation issues, getting their refill requests with a pharmacy. That's why this code is being used by many community pharmacies, and it's a very exciting opportunity for those that want to partner with physicians' offices. Because this 99490 code can be used under the general supervision requirements. If you don't remember what that means, go check out the direct versus general supervision YouTube video on that point. But they can be used under the general supervision requirements, which means it can be used by an off-site consultant pharmacist. The newest code, the 99487, is used for complex chronic care management activities. So this is a non-face-to-face, same as the other code, but it's more equal to 60 to 90 minutes of patient care activity. So this could be a major change in the patient's therapy or a major issue that someone is dealing with, something that's going to take a little bit more time than the regular 20 minutes that you would normally spend with the patient. There's also an additional code, the 99489, which allows for additional time to be added to the 99487. So if you spend even longer than 60 to 90 minutes, you can use the 99489 code to bill for additional time spent with that patient. So the main differentiator between the 99487 and the 99490 codes are, of course, time. There's also a difference in payment. So the 99490 code, we're seeing about $42 to $43 per month. The complex CCM, we're seeing about $94 for a 60-minute visit. And then the add-on with the 99487, we're seeing an additional $47 or so for that visit. Just enrolling 50 patients in chronic care management per month could equal an additional $25,000 in revenue for the practice each year. Now we're going to talk more about annual wellness visits or the IPPE subsequent Medicare wellness visit in the next video, but I want to mention that there is a code, the G0506, that can be used to sign a patient up for chronic care management during the annual wellness visit. So that add-on is about $64 for just going through the assessment and figuring out, is that patient right for chronic care management and would they like to be offered that service. So to recap, a consultant pharmacist can bill under their collaborative provider for the 99490, 99487, and 99489 codes under the general supervision of the provider, which means they can do so off-site. There are tons of opportunities for consultant pharmacists, and this is just one of the many. If you found this video helpful, I hope you'll subscribe to our YouTube channel. And for more information about pharmacist-led consulting services, join the Pharmapreneur community newsletter at btpharmacyconsulting.com/newsletter.